It's time to get down to business on TK Business Live, brought to you by the members of the Topeka Independent Business Association. Now, let's join Tara Dimmick, owner and publisher of TK Business Magazine, as we take a look into the business world of Topeka, Kansas.
Hi, welcome to TK Business Live. I'm Tara Dimmick, and it's great to be with you this Sunday. We've got a great show coming up. I've got Jennifer Harader joining me, Dr. Jennifer Harader. She's with Oasis Family Medicine and it's a private practice. And I'm excited to kind of get a chance to share with you what she's doing. So, it's that real chance for a doctor to become an entrepreneur. And she'll share more about how that practice works. And then we're going to get a chance to talk with Guth. Kurt is with American Tax Service, and I just love getting a chance to talk with him. So he makes taxes fun. I don't know how he does it, but he does it for me, and I really enjoy getting a chance to learn more about what's going on with taxes and the upcoming tax season. So we'll talk with him about that. A quick shout out to our sponsor, the Topeka Independent Business Association. The Topeka Independent Business Association really is all about being a voice for small businesses, and they want to serve as experts and utilize this program as a way to share the experts, share the business stories of our community, and share the good things that are happening in our community for the businesses. We have a phenomenal business community, one that is just diverse and fascinating, and I have loved telling every story that we've gotten to tell in TK Business Magazine. And I got asked the other day, why do you do, you seem so passionate about TK Business Magazine, why do you do it? And it was interesting. I guess I had never really said it before, but my dad is a business owner, and I grew up in a small business family, and that's what we did. I didn't know that there was a time clock at 5 o'clock. I had never realized that people actually left work at 5 o'clock, because after school we went and we worked at my dad's office, and it was oil field business. I'm not sure if he would get in trouble for that, but we worked at the shop, dusting tools from the age of 6. We were dusting tools or doing something at the shop to help out, and making a small little wage for us as kids. And then we would work until 5, and then pizza would show up, because a lot of times we would work at the office, and I loved it. I thought that this was the way things were, and this is the way things should be. And I think that what excites me and what gets me so, it makes me passionate about small businesses. Every time I get to tell a story about a small business owner, I get to tell my dad's story. I get to talk about, the passion that they put into it, the love and care for their employees, the work that they don't even know how many hours they put in, but every hour was worth it. And I know that there's this thought process of working smarter and not harder, but I think what business owners really try to do is both, right? They're trying to maximize every single hour that they can and work smarter at it. And that's what we're striving to do. And sometimes we fail, but a lot of times we really do a great job of that, and we maximize that time, and we make something that we're really proud of, and that we get to share with the community. And so getting to tell my dad's story over and over again is what gets me so excited. And so I love that the Topeka Independent Business Association has that same heart and that same passion for entrepreneurs, so that I get to do this program. And so thank you to them. Please, I encourage you to support them, to check into them if you're a small business owner or a medium-sized business owner, an independent business owner. Learn more about them at topekatiba.org. Also, real quick, TK Magazine, you can go and check out our website, tkmagazine.com, to get all the business news that's going on in the community. We want to hear from you as well. So if you have business news with your organization, maybe you're in the communications or you're the owner, and you want to share that with us, please send it to us. You can send it to Tara at tkmagazine.com. And then we will get it out on our website in the business news feed. We'll also share it out on all of our social media platforms. We're on Facebook, LinkedIn, Twitter, and we love to make sure that everybody knows what's going on. Also, find us on social media. We want to be sharing that with you, that information about what's going on in our business community. So be sure you join us on Facebook and Twitter and LinkedIn. Finally, we have a section called Business Growth. So go check that out as well. If you're either a business owner or employee, anyone who's trying to do more, be better, be stronger, this is a section that is all about trying to help you grow your business. So it's got leadership, HR, finance, accounting, all the things that you might need, even the things you might not even realize you need. We have experts talking about those areas. So go to our website, tkmagazine.com, and go check out that link, Business Growth. All right, so let's get started with a great show. I have Dr. Jennifer Harader joining me. She is with Oasis Family Medicine. Welcome.
Thank you. Thank you for having me.
And in full disclosure, Dr. Harader is my doctor, and I use Oasis. So
yeah,
I guess maybe that's a shout out for you guys as well.
Yeah, thanks.
Been very, very happy. But okay, so Oasis is different.
Mm-hmm.
So tell us about it.
So Oasis is still Topeka's only direct primary care clinic. And what that means is that we provide full spectrum of primary care, but we do it in a little bit different way. We don't take any insurance, and that's our major distinction from traditional primary care practice. Rather than taking insurance, we charge a monthly membership fee, and that membership fee allows our patients to access us as much or as little as they need to. We also allow our patients to have a little bit different type of access. We give them our cell phone numbers, we give them our email addresses, and we really encourage all kinds of appointments. We sometimes refer to them as tech or online appointments. We allow our patients to ask us questions or request appointments that way, and so it gives them a little bit closer relationship with us.
Yeah, just with my own experience, my daughter came home and I'm not the nicest mom in the world, and my poor children, when they get hurt, I'm often like, well, maybe you're hurt. And she came home and they were carrying her into the house. I'm sure at some point I should have thought she was more hurt than she was, but I was like, well, let me just text Jennifer.
Yeah, that's right. That's
so
right.
We had a texting conversation, and she was in an okay enough state that we waited until the next day to do a checkup. But I was able to have immediate conversation with you, and it was through text, which was kind of nice. Because,
it is nice
because I was able to kind of, here's what's going on, and then you responded right away, which I was kind of like thinking it would be a little while, and we were able to really go through what's this, and you were able to ask some questions, and we could ask Hope those questions. So it was nice, and that was at practice got out at like 8 or something, so that was like 8 or 9 o'clock at night that we were doing that.
Yes, and we welcome that too, just because we really discourage our patients from needing to go to an urgent care or the ER without talking to us first. There are a lot of things that can be handled the next day, things that are very stable overnight, and you just don't have any way of knowing it unless you can ask somebody. And so we really like that part of it too. And then we know the next day what's coming in on our schedule, what we need to be ready for, if there's research we need to do. So it's really cool. But it's also nice for me as a provider. I'm on call 24/7, but when someone's texting me, I can fit those text messages in between putting my kids to bed or, running errands, going to the grocery store. So it works well for us too.
Yeah, it's quite the experience.
It is. Balance, right?
Balance.
Yeah.
And I followed you. So I was with Dr. Harader when you were over with St. Francis. And then I followed you over because you were a great doctor. And
Thank
so
you.
we wanted to stay with you. So talk about why you decided that this was something that was important to you.
Sure. So, interestingly, a new study just came out that followed several primary care providers, physicians, nurse practitioners, and they found that 67% of our day is spent doing paperwork and working on our computer, and that the rest of the day is all that we're devoting to patient care. And unfortunately, that trend has just been stronger and stronger, and it's reached a point where I think the national average length of time spent with the provider and the patient in the room is about 7 minutes. And unfortunately, that just isn't cohesive with the way I wanted to practice medicine. So the model of direct primary care really enhances giving the most opportunity to have the patient and the provider in the same room together. Our appointments are scheduled usually for either 30 or 60 minutes, and all of that time is spent with us one-on-one. If there are other things like tests, those are outside of that 30 or 60 minutes. So we just really felt strongly that there was a different way that we could hopefully deliver really high-quality primary care and do it for an affordable price where our patients had good access to us and we could practice good medicine. And so it seems that the formula for doing that is taking a third party out of the picture. For primary care, my personal belief is that all primary care should be able to be afforded out of pocket. And I look at it like car insurance. So if you use your car insurance to get your oil changed or buy new tires for your car, there are some unintended consequences that would happen from that. Pretty soon, the insurance company would be telling you where to go to get your oil changed or to get your tires changed. And they would be telling you what brand of oil you could use and how often you could go. And pretty soon, the cost of those services would go up, and then the cost of your insurance would go up. So if we look at healthcare or health insurance the same way that we look at car insurance, if we can think about primary care as just the maintenance stuff that all of us need to do, and we can provide that for an affordable out-of-pocket cost, then insurance is saved for when there's something that's very high cost or very urgent that, you know, it steps in at that point and protects us from financial ruin. So we like to look at it as the right people have to have primary care that's affordable and very high quality.
Yeah, it's very easy too, because you're doing your monthly membership,
right?
And so you really don't see. At least we don't. We kind of just see it's just part of what we do, what our costs are each month,
right?
And we move forward. So, okay, so talk a little bit about costs. You kind of said you weren't, but I want to put you on the spot a little bit.
Yeah.
So, go through what are the membership fees?
Sure. So we charge a one-time enrollment fee of $50, and that is per household or per family group. And then our fees are based on age. We figure that's a fact. We're not subjecting anybody to any kind of qualification, so just a fact. From 0 to 18, it is $10 a month. From 19 to 44, it's $50 a month. From 45 to 64, it's $75 a month. And then 65 and older, it's $100 a month. And that includes any visit in the office. We don't ever charge a copay. We include as many procedures in that as we can. There are a few things that we charge extra for. And in those cases, we always tell the patient ahead of time, this is what we charge. Is it okay if we go ahead with that? We also have a pharmacy on site, and our pharmacy can be a significant cost savings for a lot of patients as well. We dispense generic medications mainly, and a lot of times they are less expensive than a patient's insurance copay, or if they're paying out of pocket, it's less expensive than if they have to go to a retail pharmacy.
Yeah, definitely. We've experienced that as well. Mm-hmm. Talked about insurance a little bit. So you need to have insurance because that's the law, right? That's what we're looking at.
Right.
But I think when I first remember you talking about this, it was like, well, then do we not have insurance?
Right.
That's not the case.
Correct. So we still definitely encourage our patients to have insurance. Right now, being a member of a direct primary care clinic does not get anyone out of the IRS penalty. So when we talk to patients about insurance, we encourage them to get the highest deductible plan that they can. If they can get a health savings account, that's great. They can't use that for our fees right now in general, but they can use it for things like lab or pharmacy that's done in our office. And then we also have started working with some medical cost sharing groups, and that can be a really good way for patients to get coverage for an incident that's medical that would be much higher cost. Those operate on the premise that primary care is going to be paid for by the patient anyway.
So last time I had you on the show, it was pretty new.
Mm-hmm.
And your goal was to get to, I think, 600 patients at the time. And now where are you at?
So we're 18 months in, and we have a few over 800 patients.
That's awesome.
So we're really doing well. And I think it's nice because it proves a couple of things. It proves that we're fitting into a need that was here in Topeka. We are taking care of patients who don't have another option sometimes because our costs are so contained that it really is a good way for them to get affordable primary care. And then I think it also proves that consumers are starting to really get this. They're starting to understand that, our goal at Oasis first is really high quality primary care, but our secondary goal is to help our individual patients spend their healthcare dollars the best way they can. And then even in a larger sense, to learn how ourselves and then teach our patients how to be really good consumers of healthcare dollars in general. So in a tiny way, we're trying to, contribute a little bit to saving our dollars and saving us from the healthcare crisis, the spending crisis that there is.
Yeah, definitely. So you added all the patients, but you've also added people.
We have. Right. So we've added just one, and we have a nurse practitioner whose name is Holly Cobb, and she sees patients independently. She is a board-certified family medicine nurse practitioner, and so that means that she can also be a primary care provider for patients. And so the two of us are there seeing the patients, and then we still have just one staff member, Erin, who's our nurse.
Yeah,
who's
she's great.
Yeah, she's doing it all. It's
awesome.
Great. Yeah.
Okay, so then I have one more question.
Sure.
As businesses are looking at this and they're trying to decide, okay, how do I deal with healthcare with my employees, especially smaller businesses? Are there any thoughts or ideas about how Oasis fits into that mold?
Sure. So if we take what we advise for an individual and we try to apply it to a small business, I think it can fit in a really great way. If the business can provide the minimum amount of healthcare coverage as far as insurance goes, then Oasis can step in and cover the actual care part of it. So we do have some partners with some partnerships with small businesses where they have a very high deductible plan, or they may even be small enough they're exempt from providing actual insurance to their employees, but they have contracted with us, and we do have a special employer rate. And so then their employees have the option to become patients at Oasis, and we provide primary care for them. We don't technically do work comp, but when something happens that keeps that employee from being able to go to work, we are a good option for being able to get that employee back to work very quickly. We've been able to help reduce sick days and things that, can cut down on productivity in an office. And then we can also help save them money.
Awesome.
Yeah.
Okay, so how can somebody learn more about Oasis?
So we'd love for you to visit our website, which is www.oasisfamilymedicine.net. We have a lot of information on there. We also have a Facebook page that we have postings on there. We love to talk to people in person, so if you'd like to call the office and set up a meet and greet, we are always happy to sit down with people and explain what we really do and answer specific questions that way.
Awesome. Thank you so much for joining me.
Thanks, Tara.
That was Dr. Jennifer Harader with Oasis Family Medicine.
My name is Jennifer Kermis, Vice President of Business Development with the Jura Credit Union.
TIBA is advice and support. TIBA is information and education. TIBA is a voice for small businesses.
One of the best things about it is that everyone's very open there. Everyone collaborates, everyone talks about best practices of, well, this is how we were able to handle this situation. This may be able to help you down the road, or this is the marketing strategy that we took on this deal versus, have you ever considered adding this product line to your business?
The Topeka Independent Business Association is strong because of its members. Become a member today by visiting TopekaTIBA.org.
I have Kurt Guth joining me with American Tax Service. Welcome, Kurt.
Thank you.
It's good to have you.
Well, I'm happy to be here.
I know normally I have you a little bit closer to tax season, but this is really, in my mind, the right time to have you here. Is the time
it is.
When we're starting to plan for tax season, so that it actually ends up in a good place.
If you have a business focus, especially, this fourth quarter is really important. That's when you start looking at, should I buy something? Should I look at, am I going to owe a bunch of tax at the end of the year? Should I be making an estimated tax payment? Should I be giving big bonuses to my employees?
I think all people should be giving big bonuses.
Right.
I think that's
especially to their accountants.
Do you get big bonuses? Is that common?
No.
Should I be
not at all?
Bonuses?
I'm trying to start the trend, right? I'm bringing bonuses back. That would be nice for your accountants. So.
All right. So tell me about tax season. What should we be expecting about this tax season?
Well, if we're starting from the standpoint that, we both know that there's a big election coming up, and that people always seem to have opinions on whether, that affects things, especially in a obviously presidential election cycle. And of course, the stock market and that type of stuff comes into play as well. But as far as actual tax law, I wouldn't expect a lot. We did have fairly major bills in 2015 and 2016. It's a lot of that still being implemented and that type of thing. And I don't think there's a lot of political willpower in the works to pass big reform bills. That said, I don't have a crystal ball. From what I've read, I don't see anything on the horizon that's going to be gigantic that's on the actual tax law or tax return affecting standpoint. There are some other areas that are being affected, like the wage and hour stuff. People who are exempt employees, that changing, and the required salary that you would have to have before you're considered exempt, and all those changes that are actually going to affect employers a lot more than from the tax deduction side of things or tax credit side of things. So that's huge. But it's not. In fact, it's probably bigger than a lot of tax laws that we've passed, in quite some time, because it's just going to affect how people get paid.
Yeah, we've talked a little bit with some HR professionals about that and how big of an impact that could make on a single business.
Oh, huge!
Depending on how they've been paying their employees.
Yep, they're going to go to hourly, and they're going to have a big structure change. How they provide benefits, that type of thing, and that's unfortunate that you have kind of a rug pulled out from under you on those changes instead of something that's phased in or seems a little bit more moderate. But, I think that's going to be a lot of what we struggle with as far as on that side of things. But I'm not going to get a lot of that from the tax season standpoint. That's going to be more of the payroll side and the ongoing side. And I don't foresee a ton of my clients being affected because they're mostly our employees. Or they're small enough that it didn't really do too much. But I do know that us personally, we are getting affected by it. And, I'm sure that other small businesses are too. So
yeah, I think so as well. So we talked earlier about the earned income credit and child tax credit.
Yes.
Tell me about that.
So those are credits on a personal side that you get for certain levels of income or having a child under 17. And the real change there, not so much in amounts or anything like that, is basically how it's going to get paid out. So that is, if you can imagine, that generates a lot of money. It's $1,000 for the child tax credit per child up to a certain amount. And then for earned income credit, I mean, that can be quite a bit of money, $3,500 or more for the credit. And so that's a huge area for fraud. And it always has been. So what the IRS is trying to do in this world now of cybercrime and ID theft and tax fraud is on the rise and that type of thing is they're trying to prevent some of that. So they're always trying to find ways of doing that because they have two things they have to satisfy. One is they have to get the money that's owed back to the client or to the taxpayer as soon as they possibly can or reasonably can. And they also have to protect the identities and of all taxpayers and the tax laws itself. Make sure that it's fair. So what they're trying to do is balance that line, and so what they finally hit on is that they're going to their idea is that they're going to delay the refund. So people who are filing early from like January 15th through the end of the month, they're going to end up having a delayed refund because all these cyber criminals a lot of times file really early on somebody else's social security number and then get that refund back. And so what they're hoping to do to avoid is those early filers that are fraudulent. Of course, the other side of that is that the people who are legitimately filing may have to wait for a while to get their money back.
Right, but at least they get their money back, right?
They do get their money back, yes.
What happens if somebody
it's called a pay and chase theory. So basically what happens is, let's say that you get a fraudulent tax return filed on you. They would pay that potential criminal your refund or whatever refund they came up with. And then when you go to file, you can't electronically file, but you mail in your tax return. Well, eventually they'll clear it up and send you the money as well. So the government is potentially out. You've had to wait.
Oh, wow.
So you get the money that you're supposed to get. And let's say that's a couple $1,000s. But the other person could have gotten $7,000 or $8,000. They're going to try to pump that up because they're just making numbers up. They want to get the biggest bang for their buck. So that'll be refunded. So the government's out. I mean, this is billions of dollars a year. Yeah, it's huge, and it's only on the rise. So it's a real problem, and the IRS is doing the best job they can. I think there are some very simple things that they could do, but they don't want to implement that kind of big program because it's going to either delay refunds or cause a bunch of, I guess, just consternation within the taxpayer base and that type of thing. So, and one of those is when you get your ID stolen, the first thing they'll do is they'll issue an ID number. So you have to have that number to file, and it only goes to your address of record. So that's a kind of a shore up thing. But that program would be a little hard to implement. Amongst all tax-paying Americans. And then they would just find a way around that too. So it's tough.
Ooh, that is...
Yeah.
That's some rough stuff. Okay, so another thing you mentioned to me in our chat and kind of conversation before you came on was some of the due dates.
Yep, so this is on the business side. So the only thing that's really happening as far as the due dates go is that partnerships used to be due on April 15th and September 15th as the extension deadline. Now it's going to be March 15th and the September 15th deadline. In the S Corp structure or subchapter S, which is pass-through income, if you know, basically goes through to the individual, is actually going to be due on April 15th.
I'm writing all this down is what I need to be doing. So
Right, exactly.
remember.
So, yeah, exactly. So,
Which is nice, though, because, I mean, for those of us who have been doing it on March 15th,
yes.
we'll take
Sorry.
April 15th.
You know what? I screwed that up.
He's messing me up.
I messed you up. Yeah, sorry. C Corps. C Corps will be moving to April 15th.
Okay.
And S Corps will be moving. It will be staying at March 15th, and partnerships will be moving to March 15th.
Partnerships.
So all pass-through income is now on March 15th. And that is because they issue a form that's called a K-1. It basically shows the share of income or loss, and that goes on your personal return. Well, if your personal return is due on April 15th and your partnership return is also due on April 15th, well, something's got to give there. So they're just making that a little bit more even so that pass-through income is all due on the same day. And then a C Corp, which doesn't issue a K-1 or pass-through income on that stuff, can be filed a little bit later.
So there's no reason it needed to be on March 15th.
Correct.
Really?
Correct.
Very good.
So,
Very
yeah.
good. Okay, so planning. So let's talk about planning. So businesses, you talked a little bit on it. So let's just kind of recap and do a little bit more because I need to get all my notes in order here.
Sure.
For my business. So what all should a business be thinking about? Because it's getting ready to be fourth quarter. It is
Right.
fourth quarter.
It is fourth quarter.
Oh,
Yep.
when did this year go away? So what should they be thinking about and preparing for? Because, I mean, New Year's right around the corner.
Well, I'll tell you and as we talked about, that fourth quarter is important because, that's where a lot of stuff you realize what your year is going to really be like. People try to plan in June and July, which I like, but you've got a little bit more wiggle room because things could change between a lot more in 6 months than they can in 3. But what is most important is that as you start to realize what your tax return is going to look like, if you're going to owe a lot, you might decide, we need a new truck, we need a piece of equipment, and you can take advantage of depreciation laws to write that stuff off all in 1 year, as opposed to taking it over 5 or 7 or more years. And so it's really helpful to get that planning stuff in that fourth quarter because otherwise you're either spending money too soon, you don't have it at the end of the year, or you are scrambling around trying to find something when it's too late, to do it in a week when you can't close on something in a week or you can't get the financing in place in a week. The other thing is if you are going to owe money, you want to look and see what you need to set aside and maybe do your billing beforehand to put cash in the bank or hold off on billing to kind of offset a higher revenue year. Hopefully everybody's having a higher revenue year.
That'd be great.
But that's kind of the importance of it is talking to us in that fourth quarter to kind of get that strategy in place and do the best job you can to plan for that. And of course, pass-through income, if you have a SEP or a simple plan that you can contribute to, it can help alleviate some of those that tax bill as well. And that's when you start planning to set aside money for that. Of course, there's a little bit more wiggle room after the end of the year, but that's when you want to start thinking about that stuff.
Awesome. So. Okay, so Kurt, how can somebody learn more about American Tax Services?
Well, they can go to our website, which is atstopeka.com. I don't know if I have to still say the www anymore or not.
I don't know. I always assume people know.
Or triple dubs. Right. Triple dubs, right. So the other is that they can obviously call us at 232-1724. And they can also go to our Facebook page, which I think is just American Tax. I don't know how you find things on Facebook.
You just type
I have no
in,
idea. Yeah, I guess find American
Kurt's
Tax.
Obviously, very engaged in Facebook.
Very
social media heavy,
That's
aren't
right.
you?
Yeah, I am.
You're Twitter. Can people find you on Twitter?
I think we can. I think we have a Twitter account.
If not, you can find Kurt.
I know that we have a Twitter account. I am not sure how much we use that Twitter account.
But you know you have one.
We know we have one. So.
Well, he was following political people, so he was telling me stories about what he saw on Twitter, so I just assumed you were a Twitter follower.
I think I see them on the internet saying that, somebody said this on Twitter.
Yeah.
Right, so I use the internet. Right.
That's good. We're moving forward. Okay, so go check out American Tax Service, atstopeka.com.
Correct.
www.
ATSTopeka.com.
Got really off there. But we're good. That's Kurt Guth, American Tax Service. Thanks, Kurt.
Yep.
Thanks so much for joining us on TK Business Live. And thanks to my guest, Dr. Jennifer Harader with Oasis Family Medicine and Kurt Guth with American Tax Service. Also, a big shout out again to the Topeka Independent Business Association. Learn more about them at topekatiba.org. And have a fabulous afternoon.
Thanks for joining Tara and her guests on TK Business Live. Join us again next Sunday at 11:30 to hear more from our community business leaders, entrepreneurs, and people making a difference in the landscape of how business is progressively moving forward in Topeka. TK Business Live is brought to you by the members of the Topeka Independent Business Association.